Hi, Alistair. Thank you very much, and good evening, everyone. So I'm going to talk a little bit about the impacts we've seen at Macmillan on what people living with cancer have told us, and then some of the issues we've seen in primary care. So obviously, we know that receiving a cancer diagnosis is one of the most stressful things somebody can go through, and one of the impacts of the pandemic has been the delays and changes to treatments that we've already heard about this evening. And from some of the work we've done, we've heard from people living with cancer that what this has done is add to the stress and the confusion that people would normally live with through a cancer diagnosis and treatment for cancer. But the current situation has made this worse, partly because a lot of the changes that they've seen, they've not necessarily fully understood. And addressing this kind of information and communication issue has been one of our priorities at Macmillan throughout this time. So one of the things we did was we created a coronavirus hub on our website to try and ensure that everybody living with being diagnosed with cancer through this time, or perhaps just before the pandemic hit, has access to all the information that they might need, has answers to the questions that they have, has someone to go and speak to and ask questions to 7 days a week when they might not necessarily be able to get hold of their treating team, and also, very importantly, support for people throughout this time who may be shielding at home. So some of the innovations we've done are starting a telephone buddying service that's available for everybody that might be at home, suffering from loneliness and have questions through this time, and also a service called SafeFit, which is a virtual rehabilitation service that we have just launched. As a GP, obviously, as all GPs through this time, like all our secondary care colleagues as well, we've had to make some significant changes to the way that we work. The main one being the move to mainly virtual appointments. Some of the other changes we've had to be aware of is we've heard about the concerns about early diagnosis, and we did see often quickly changing changes to some of the urgent suspected cancer referral pathways. And as GPs, we've had to really try and stay abreast of all these changes. We've had to learn new ways of managing risk for sure, and that's really pertinent when it comes to people presenting with cancer symptoms. And we've had to ensure we've got robust safety netting processes within our systems. Now, although we've seen some of these limitations, we've heard about the significant reduction in numbers of urgent suspected cancer referrals, and there will have been a small impact by some of these changes. But what we have actually seen, and I think it's already been hinted at, is one of the biggest changes we've seen is the reduction in numbers, a significant reduction in numbers presenting to primary care with either specific concerns around cancer or just with concerning symptoms. And some of this will be because people have been concerned about presenting to primary care because of risk. But unfortunately, what we've heard is that, and I've certainly heard it from the participation groups that I work with, are that people felt that primary care wasn't open. They felt that primary care was, I've heard that they felt primary care was closed. Of course, we've not been closed. Of course, we've been open throughout this whole time. We've been working in a different way. It's not been business as usual, but we've been open as usual. And just as accessible as usual, although perhaps even more accessible, just accessible in a different way. And it's a little bit concerning that we're still hearing that people, even 12, 13 weeks later, feel that we're not accessible to them. So we've got a lot of, one of the things we need to do is a lot of work, to make sure that people know we're available, and also that if they have concerning symptoms, that we will find ways to investigate them in a completely safe way. One of the things we did at Macmillan, just like they did at CR UK, was create a video with some of our Macmillan GPs that we put out there through social media to say to people, if you've got concerns around cancer, please do contact your GP just as you normally would, and they will be able to help you. And it was interesting, I'll finish now because I'm conscious of time, but I saw a little quote come up at the beginning from one of the participants saying that solidarity is the key, and I agree. One of the things I've seen through this whole time, partly in my role as a clinical director for a Cancer Alliance, is that us all working together as different professionals has been just essential in ensuring that things have worked well. And we've had our network of over 200 Macmillan GPs around the UK working with secondary care to ensure that communication is working well, because that's vital to us all effectively working together.